Everyone, welcome back to my YouTube channel. Today we are going to talk about sphenoid bone, and here at the side you can see the skull views. Yellow color bone is sphenoid bone, and below you can see the individual structure of sphenoid bone for the reference. So let's start the topic with introduction. Sphenoid bone is one of the most complex and centrally located the bone in the human skull, as you can see in the diagram of cranial cavity, that is second diagram, upper second diagram. It lies at the base of cranium, behind the eyes, and in front of temporal bones. It is often referred as the keystone of the cranial floor. The sphenoid bone connects with all other cranial bones and contributes significantly to formation of orbit, nasal cavity, and cranial cavity. Anatomical location. Sphenoid bone is situated at the middle of skull base. It extends across cranial floor from one side to other, articulating with multiple bones, as you can see here in the second diagram. Anteriorly, it articulates with the frontal bone and ethmoid bone. Laterally, it articulates with the temporal and parietal bone. Posteriorly, it articulates with the occipital bone, and superiorly, it articulates with the cranial cavity supporting parts of brain. Parts of sphenoid bone. Sphenoid bone has a complex structure consisting of several parts. First, it has body of sphenoid. You have to see the third diagram for the reference for all the parts of the sphenoid bone. So we have body of sphenoid, greater wings. As you can see, the red color wings are the greater wings of sphenoid bone. Lesser wing, that is the green color wings, and pterygoid processes are also there. That is the yellow part of here. Now let's talk about the body of sphenoid bone. It is a central portion, as you can see here in the diagram. It contains sphenoidal air sinuses, which are air-filled cavities. It houses the sella turcica, that is a saddle-shaped depression that holds the pituitary gland. It has tuberculum celli, dorsum celli, and hypoglossal fossa that are features of sella turcica. Next, we will talk about greater wing of sphenoid bone. Here you can see the red color area of the sphenoid bone. In the third diagram is the greater wing of sphenoid bone. It extends laterally from the body of sphenoid. It contributes to the floor of middle cranial fossa, the wall of orbit, and the temporal fossa. It contains several important foramens, including foramen rotundum, that is for the maxillary nerve, foramen ovale, that is for the mandibular nerve. It has foramen spinosum, that is for the middle meningeal artery. Now let's talk about lesser wing of sphenoid bone. As you can see here in diagram, the green color area is the lesser wing of sphenoid bone. It is smaller and more superior than the greater wings. It projects horizontally and forms part of the roof of orbit. It contains the optic canal, which transmits the optic nerve and ophthalmic artery. Next is pterygoid processes. As you can see here in the diagram, the yellow color area is the pterygoid processes. It extends downward from the junction of body and greater wing. Each process consists of medial and lateral pterygoid plate, which serve as an attachment point for muscles of mastication. The pterygoid fossa lies between the two plates. Now let's talk about key foramina and canal of sphenoid bone. Sphenoid bone is pierced by several openings that transmit critical neurovascular structures. They include optic canal for the optic nerve and ophthalmic artery, superior orbital fissure for cranial nerve number 3, 4, 5, and 6. Next is foramen rotundum, that is for maxillary nerve, that is the branch of fifth nerve. Next is foramen ovale, that is for the mandibular nerve, that is also the branch of fifth cranial nerve. Next opening is foramen spinosum, that is for the middle meningeal artery. These opening plays an essential role in vision, facial sensation, and mastication. Functions of sphenoid bone include: first, structural support, as it acts as a central bone that connects the bones of cranium. Second is protection, as it protects the pituitary gland and parts of brain. Third is cranial nerve passage, as it allows passage of several cranial nerves and blood vessels. Next is muscle attachment, as it serves an anchor for several muscles involved in chewing and movements of lower jaw. Next is sinus function, as the sphenoidal sinus help reduce skull weight and improve voice resonance. Now let's talk about ossification and development of sphenoid bone. The sphenoid bone develops from cartilaginous ossification, that is also called as endochondral ossification, beginning around the 8th week of fetal life. It arises from multiple ossification centers that fuses over time. Its fusion is usually completed by the age of 20 to 25 years. Due to its complexity, the sphenoid bone is often one of the last bones to fully ossify and fuse. Now let's talk about clinical significance of sphenoid bone. First is pituitary tumor. As since the sphenoid bone houses the pituitary gland in sella turcica, it is assessed surgically through the transsphenoidal approach. Second is fractures, as fracture to the sphenoid can damage important cranial nerves and arteries. Third is sinusitis, as inflammation of sphenoidal sinuses can lead to deep headaches and complications due to proximity to the brain. Next is optic nerve damage, as tumors or trauma involving the optic canal can impair vision. Now let's talk about conclusion of this lecture video. Sphenoid bone is a vital and intricate component of human skull. Its central position, multiple articulation, and passageway for critical nerves and vessels make it essential in both anatomy and clinical medicine. A deeper understanding of sphenoid bone is necessary for fields such as neurosurgery, otolaryngology, ophthalmology, and dentistry. And this was all about sphenoid bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.